Well, hello and good morning. My name is Jason Perry, and I'm the National Sales and Marketing Director here at MAS. I'd like to also introduce you to MAS. We are a nationally recognized award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, just outside of Birmingham, where we're going to have probably 82 degrees and sunny, well, partly cloudy, but 82 degrees today, so very nice. But we're excited to share with you that MAS has become a partner of Integrity Marketing Group in October of 2019. We've had a long-standing relationship with Integrity Marketing Group over the years, so it was a natural alignment for us to become a platform partner. Through this, MAS will be able to bring more products, more tools, and more resources to our broker distribution. We're truly honored to be working alongside our other partners in our industry. And Integrity isn't just on the cutting edge of insurance technology, it's really leading the way. And developed by world-class experts, our proprietary tools, resources, and exclusive services to help customize the insurance experience so that consumers can find the right coverage and be prepared for the good days ahead. Here at MAS, we are proud of the superior support, service, and training we provide to agents across the country who work with us. We take great pride in our relationships with our agents and our carriers. Our staff provides marketing strategies and assistance, creating numerous opportunities for our agents through our lead programs, our Turning 65 platform, the Agency Builder program, Fast Start, and other initiative programs. In MAS, marketing managers and directors are eager to work with producers to help you grow your business. We can provide a market analysis of products available in your area to assist you in developing a strategic marketing plan for your business. We're always up to date on the latest products, carriers, and lead programs and services as they become available. And of course, we're always available to provide both back office and field support, making it easier for you to concentrate on your sales growth. So our goal at MAS is to help you grow your business. And our specialty is the senior market. Our carrier portfolio is supported by Medicare supplements, prescription drug plans, Medicare Advantage, final expense, whole life, term life, universal life, annuities, hospital indemnity, critical illness, cancer plans, dental, vision, and hearing, just to name some of them. And so here's just a short list of the portfolio of some of our carriers. So just to kind of give you an idea. And this is our exclusive lead program. I'm not going to read through this. Those of you who've been on here before can see this, and we do give a lot of different lead programs, or have a lot of different lead programs. So give us a call and we can talk to you about one specific to you as well. But I do want to make sure you check out the new Medicare Center. It is a one-stop shop for everything you need to successfully navigate your sales and enrollment processes. You can now experience Medicare Center with the full power of CSG's resources, which includes e-apps, data analysis, quoting tools, competitive analysis, heat maps, and exclusive website plugin to capture Medicare supplement leads. This is actually a plugin. If you have a client-facing website, we can plug in and help you capture Medicare supplement leads, or actually leads for anything to do with Medicare. The plugin will give you the information, but we can also set up on your website where they can access the Medicare Center and actually enroll themselves just being on your website. How cool is that? So another one of the tools we have, this tool actually will put you on the cutting edge of technology, offering you the ability to run quotes for Medicare supplements, Medicare Advantage. You can compare products side by side. You can download current applications and outlines of coverage for desired plans. You can even email applications and outlines of coverage directly to your clients. So all who wish to use the tool need to register for username and password on our website, which is just MedicareAdvantageSpecialist.com. And you must be contracted with MAS for select Medicare products to be able to use this as well. Talk to us today and we'll give you more information if you have questions about that. This is a really great tool. This is our T65 locator, so it makes it easy for you to find local prospects. It's easy to use, and pulling up locations on the map is a breeze. The best part, it's free for our agents who do business with Medicare Advantage, so no more having to buy a T65 list you get this T65 app locator for free working with us at Medicare Advantage Specialists. Another one of the turnkey systems we have is our Turning 65 workshop. So we all know that growing your business is only going to happen if you develop a winning strategy, you consistently put in the work, and utilize smart tools and platforms to make it easier for you to deliver your experience to the right clients. So that's why we developed this Turning 65 workshop platform. So we assist our agents in identifying target markets for the Turning 65 population, and we created a process that's so simple for agents to follow that we now have so many agents hosting weekly and monthly meetings across the country, creating a tremendous stream of lead generation. So if you want more information about this, talk to one of our marketing managers today. For those of you who want to actually build an agency, we can help you do that. So with our Agency Builder program, lots of different tools that we can use to help you recruit. We have specialized call campaigns, and then we do have some co-op available to help with the lead program. So real easy to do that. Just reach out to us, and we'll get you started on that program. Here's another one of our incentives. This is our Fast Start incentives. This is for new agents. So, we do issue a $25 gift card for your first issued app. Just one app, we'll give you $25. $75 gift card with 4 more apps issued in a month, and a $50 gift card if you refer an agent and when they to MAS and they write their first piece of business. Although this does not apply to Medicare Advantage or dental production. So why choose Medicare Advantage Specialists? Because prospecting can be a challenge, but we're helping you by arming you with the tools necessary to help you be successful. So we understand that our long-term success will define itself based on your success as an agent or a carrier. So Medicare Advantage Specialist is committed to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your customers. Agent support is our primary goal. We provide every tool we can to identify and assist you in your efforts to identify, inform, close, and follow your sales process. In practical terms, our marketing team works with you arm in arm to deliver print media, internet, direct mail, and other marketing tools to help keep your pipeline moving. So we do have one of the most experienced support teams in our industry. So when you work with us, you don't need to buy another T65 list anymore like we talked about earlier. Plus, you get access to the Medicare Center, free marketing customization, and our quoting tools, and really just so much more. And so here's how you can contact us today about any of the topics we just talked about. There's our toll-free number. You can also take a look at our website, MedicareAdvantageSpecialist.com, wealth of information. If you are not an agent with MAS, you can still look. But if you are an agent with MAS, make sure you've registered to get into the back office. Just a ton of information there to help you. And if you have any questions about anything or navigating anything, please reach out to us, 800-480-9857. So without further ado, you may have been asking yourself, really, what now? So we're here busy strategizing during the SEP and planning for SEP sales. So make sure you outreach to your marketer. We got some great data put together for the 2022 landscape, and as well as tons of marketing ideas. And with that being said, let's go ahead and get to today's webinar subject. With us today, we actually have John Stokes, the North Alabama Aetna Medicare Broker Manager. And John has had a long relationship with MAS, and he actually started his Medicare career at MAS. How about that? So we're so proud of him and so proud to have him here with us today. So John, I'm going to go ahead and make you the presenter, and let's see if we can get started.
As I get my screen set up, I will say Jason's exactly right. I did get my Medicare career started with MAS, and a lot of what I know about Medicare today, I have to thank Jason Perry for. So I can't tell you how much I appreciate our relationship with MAS and how good they've been to me over the years, and I know they will do the same for you. So as Jason said, my name is John Stokes, and I am the broker manager for North Alabama for Aetna Medicare. If you saw when Jason was going through the through the slide with all the carriers that they represent, you may not have seen Aetna's name on there. And I was even taken aback for a second. I said, wait a second, where's Aetna? Well, if you saw CVS Health on there, we were purchased by CVS Health about 4 years ago. So you can know that Aetna not only has a brand name throughout the state and through the country, but we are also part of one of the biggest brand names in the world, which is CVS Health. So with that, what we are going to be talking about is our 2022 Medicare Advantage DSNP plans here in the state of Alabama. As you may have seen on the email invitation that came out, it said best in class DSNP plan. And I think once you see the benefits that we're about to go through, you're going to see that we really do have a best in class DSNP plan here in the state of Alabama. So we're going to, what are we going to cover today? We're going to cover our DSNP opportunity. We're going to very little touch on extra help and the Medicare Savings Program. We're going to talk about the plans. We're going to talk about how and why to sell Aetna DSNP, product availability and state requirements. And I will even show you a quick little overview of what we call Think Agent, which is our enrollment platform. You guys have a great opportunity with MAS to have the Medicare Center, and I have seen firsthand what a wonderful and useful tool it is, but it also, technology, we always have maybe an issue or something like that. It's always good to have a second platform, and we have built our platform from the ground up, and we're very excited about it. So I do encourage you to take a look at that, and even if you are using the Medicare Center, have Think Agent as a fail-safe for yourself. So market specifics for the state of Alabama. Our star ratings for our plans have improved this year. We went from 4 stars to 4.5 stars for 2022, and we're hoping that takes one more jump in the future. We would love to get to that 5-star plan, and we are working very diligently to get there. So this is a great slide to show you our service area here in the state of Alabama. If you look in the north where you see purple, that is the dark purple is going to be the counties that we were in for 2021, and then that we continue to be in for 2022. And then if you see the blocked purple, it may be hard to see. I don't know how big your screen is, but that is our expansion in the north for 2022. So we were already in those dark purple counties, and we expanded to Lamar and Fayette and Pickens, Bibb, which all surround Tuscaloosa County. So we are very excited about that, and we've had a really great start in that market, and we expect that to continue to grow. So when we look down at the south, it's the same concept. The dark blue is where we were in 2021 and continue to be. So that was Mobile, and then Montgomery, Autauga, Dallas, and Lowndes. So it's that Mobile and Montgomery area. And then we have expanded this year into Baldwin and Escambia County down around Mobile, and then the Dothan market, which starts from the bottom right corner of the map from Houston up to Henry, Barber, and to Russell. So we have had great DSNP expansion this year. And I can tell you firsthand, those expansion markets, if you are in, around, near, or like to travel, those expansion markets are real. There's a lot of opportunity there. So we keep it very simple when it comes to figuring out which plan that you need to have someone on. We have one book here in the state of Alabama for our DSNP. So when you order DSNP kits, you only have to order one kit for Alabama, and we have it broken down similar to as you saw on the map by our North plan and our South plan. The H3239-002 is our North plan, and you see all the counties for that. And then the H3239-003 is our South plan, and that shows all the counties for that. So just to touch a little bit, and I know this slide is probably going to be very hard for you to see. And if you have follow-up questions about this, let Jason, let myself know, and we can share this with you or have a discussion with this about you, or with this. Let me try that again. We can have a discussion with you about this. There it is. This shows our Alabama hospital network here in the state. And we have a very, very strong hospital network here in the state. Outside of a couple of omissions, we really have every major hospital. When you look at the north, we have everything, every major hospital except for UAB, but that we don't look at that as a downside because very few people in our market have UAB. So we're very robust in the north. I would say our only real, I guess I don't even like to say it as a whole, but in the Montgomery market, there is one county or one hospital that we are missing, and they've got a handshake deal with UAB, but we are working to try to get them in network, as we speak. So this is a great slide just to get an overview of what our hospital network looks like here in the state of Alabama. So I'm going to get right into the benefits, and I'm going to go through this line by line, but I'm not going to spend a ton of time on each slide. We can share this with you because, as you see, I'm going to go through the north and through the south, and although there are differences as I go back and forth, a lot of things will be similar. So when we start at monthly premium, first thing I need to touch on, and we will talk about it a little bit as we go on, our plan not only takes full dual members, but we also accept partial duals onto our plan. And so that's where you see monthly premium 0 to $21.80. So obviously, if they're a full dual, all of this will show up as zeros for them. And depending on their level of LIS, they could incur a premium. And if you have questions about that, we can discuss that later on. Whether they are a full or a partial, they will have $0 PCP and $0 specialist and that's in network. When you see out of network, it says NA because this is an HMO, a DSNP HMO, so they do have to stay in network on this plan. Inpatient hospital, $0 for days 1 through 5. Outpatient hospital services, 0. Lab services, 0. Now, this slide actually, and I was just looking at it, and I'm going to get this changed, where it says X-ray, diagnostic test, and diagnostic radiology, 20%. Obviously, that's not going to apply to full duals. That should say 0 or 20%, similar how it says at the monthly premium. So just know that 20% is not going to apply to your full duals, just depending on their level of LIS. They may incur that 20% for X-rays, diagnostic tests, and diagnostic radiology. So out-of-pocket maximum, once again, not going to apply to full duals, $75.50. Drug copay, $0. And I'm going to touch on this a little bit more. I'm not going to spend too much time here. But another huge benefit to this plan is members do not pay drug costs on the DSNP plan, the DSNP plan in Alabama in 2022. So like I said, I'm going to breeze over that because I'm going to touch on that a little bit more as we go on. Our dental in the north is $3,000. Once again, I said a best-in-class DSNP plan, $3,000 in dental that can be used for anything. They can use their dental for routine dental, whether it be fillings, crowns, anything like that. But we also accept implants as well. They can use that $3,000 towards anything outside of cosmetics, teeth whitening, things like that. But our dental is very, very strong this year and gives the members a lot of options to use that $3,000 towards. Our vision is $300, $300 benefit for that. Over the counter, once again, I'm going to touch on this a little bit more, so I'm not going to spend too much time right here. But our over the counter is $300 a quarter, and that can be used in a CVS store, over the phone, or online ordering. So I will touch on that a little bit more as we go on. Transportation, 48 one-way trips. I think is pretty standard across the industry. Where we stand out when it comes to transportation, and it doesn't show it on this slide, is up to 100-mile radius for any one of those trips. So, if you're here in the middle of the state and you've got a member in Montgomery and they need to get to Birmingham, well, I made that drive on Saturday night, and it is less than 100 miles. So they can use those transportation, one-way transportations, 48 of them, up to 100-mile radius. We have introduced this year a $50 healthy food card, and that is $50 a month that they can use that for. I will touch on that a little bit more as we get into those benefits as well. Hearing, $1,250 per ear, and that is per year. That is not a buy or a tri-annual benefit. That is an every year benefit. So between both years, they get $2,500 in hearing. Silver Sneakers, we are still part of the Silver Sneakers network, the largest senior gym membership network in the country. We've got a great relationship with them, and that will continue moving forward. Meals at home, 28 of those, that is upon discharge from the hospital. So if you have a member that is discharged from the hospital, they're going to get 2 meals a day for 14 days upon discharge. The member doesn't have to do anything to start that. We partner with a company called GA Foods, and upon discharge, that process gets started, and they will receive those meals, like I said, 2 meals a day for 14 days, and that's lunch and dinner, and they will get that in either pantry or frozen options. Once again, we'll touch on that a little bit more as we go on. So when we go to the South, a lot of things are similar on this, but I'm about to cover a couple of real standout here where we're already best in class in the North at the $3,000 in dental, but when we talk about the South, it gets to be a little even ridiculous. I mean, I've never seen benefits like this here in the state. So monthly premiums still the same, 0 to $25.40, depending on their level of LIS. If they're a partial, PCPs and specialists $0, inpatient hospitals 0, outpatient hospital 0, lab 0, X-rays, diagnostic tests, diagnostic radiology $0 for full duals, depending on their level of LIS. They could incur that 20%. Out-of-pocket maximum, once again, does not apply to the full duals. Drug copay, so pretty much outside of a little difference in monthly premium, everything is the same up until that point. Then we get to the dental. $4,000 of comprehensive dental that they can use annually on this plan. So same as I talked about previously, implants, dentures, anything that they need outside of cosmetic, they can use that $4,000 towards. Vision, $515, so got even richer when it comes to vision. You can get probably multiple pairs of glasses and even some contacts for $515 a year for that. Over the counter is going to be the same, $300 a quarter. Transportation, 48 one-way trips, with the star of that once again being the 100-mile radius per trip. Healthy food card, $50 a month. Hearing, $2,500 between both ears every single year, and then the Silver Sneakers and the meals at home. So as we go forward, we're going to talk a little bit more about the breakdowns of those benefits. So as I said, over-the-counter benefit. We have over 80 select CVS stores here in the state of Alabama where your members can utilize their $300 every quarter. Keep in mind, that does not roll over. So they need to be maximizing that every single quarter. And something that I just recently, or something that was recently brought to my attention that's good to know, they get 3 uses for that per quarter. So they need to use that $300 in either 3 visits to that select CVS store, or 3 online orders, or 3 over-the-phone orders. So keep that in mind. That's a good little note to have. I've already covered the meals at home pretty extensively. silver sneakers, value-based enrollment. Obviously, that is our completing our HRA. We will pay you $70 per HRA that you do. If you have questions on that, talk with Jason, talk with me. We'll go into that a little bit more. Podiatry, our podiatry benefit for our DSNP members, and this is especially important for your diabetic members. They get 12 routine foot care visits per year, a $250,000 worldwide emergency coverage. I realize that most DSNPs aren't jet setting across the world, but if they do have family and they're out of the country visiting family, they do get that $250,000 worldwide emergency coverage. And then the healthy food card, which I will talk about a little bit more. If you will look in the bottom left corner of this, to me, when we talk about the benefits of this plan, we talk about all the dental that we offer, all the vision, the $300 a quarter of over the counter, the healthy food card. It's all incredible. But to me, equally as incredible is what we do with our model of care team. We have a model of care team that is put together that services every single one of our DSNP members. And every single one of our DSNP members is assigned a model of care manager. So what does that mean? Well, it's important for for the member, but it's also important for you, the agent. When you have a member that calls you and they're having issues with a bill, with a referral, they need a piece of equipment, whatever that issue may be, who's that first phone call that they're going or who's that first person they're going to make a phone call to? That's most likely going to be you, the agent. And in a lot of situations, you're running appointments, you're out, trying to grow your business. You may not know how to solve that issue for them, and you may spend a day, 2 days calling me, calling the company, trying to get that issue solved. Well, in our model with our DSNP members, you just make a 3-way phone call to their model of care member, get them in touch with them, and then the model of care team is going to take care of all of their issues at that point. It doesn't matter what it is. They are there to serve every single one of our DSNP members. So I just think it's such a huge part of what we do with our DSNP plan here in the state of Alabama, and it doesn't show up as a line item when you're going through benefits. But it's just such a giant part of what we do here in Alabama. Fall prevention devices, $150 allowance per year for safety devices. So that can be toilet chairs, bathroom or shower bars, anything that's going to help your member prevent a fall. They're going to get a $150 allowance every year to be able to do that. I've already kind of gone pretty extensively into dental, into hearing, into vision. They do have access to the personal emergency response system. So it's the 2022 version of Help, I've Fallen and I Can't Get Up. It is done through LifeStation, and it is a medical alert system that provides users 24/7 access to help in the event of a fall or other emergency. And it does include GPS and fall detection at no additional cost. So really great benefit on this plan. And then the transportation, like I said, 48 one-way trips. On this slide, as I'm going through this and reading it with you, I'm seeing a couple of typos in here. So this one says 60 miles. That has been updated to 100 miles this year. Our plan has partnered with Access to Care. So they are the company that oversees our transportation, and they utilize Lyft to get your members where they need to go. And so I encourage you, when it comes to transportation, don't wait till the last minute to get that transportation scheduled. Get it scheduled multiple days out, if not a week out, to avoid any issues or disruptions when it comes to their transportation. So as I said, I talked about fall prevention, some of those items, non-slip bath mat, suction grab bar, as you can see on the screen, just a myriad of different items to help your members prevent falls around their home. So this is our vendor contact list for all of those things: dental, hearing, vision, personal emergency response system, transportation, over-the-counter, meals, fitness, healthy food card. Has everything right here for you if you have an issue. But, it's kind of a hat on a hat, because if your member's having an issue, you shouldn't really need to reach out to any of these. All you need to do is help them reach out to their model of care team member, and they will take care of their issue with any of these services that we have on the screen. So I briefly went over this because I knew this slide was coming, and another huge line item when we talk about best-in-class DSNP plan in 2022. So we have a competitive formulary for our pharmacy coverage, but as you can all see, the highlighted portion of this, all of our DSNP members will pay $0 for all covered drugs on tiers 1 through 5. Well, I can tell everybody on here, there is not a tier 0 drug, and there's no such thing as a tier 6 drug. So all drugs fall anywhere between tiers 1 and tier 5. So I'm going to read that again. Members will pay $0 for all covered drugs on tiers 1 through 5. That is a huge benefit. Your members are going to pay $0 for their drugs when they are on this plan, which we were just so excited to introduce this year. And that's going to be $0 at preferred or standard network pharmacies. So it's not like they have $0 if they go to this one particular pharmacy. Whether it's a preferred or a standard pharmacy, they're still going to pay that $0. Something else we've also added this year, we've gone up to where members can get up to a 100-day supply for eligible Part D drugs. So instead of a 90-day supply, we provide them with a 100-day supply. Maybe they're doing mail order, something gets lost in the mail. They're not going to be running up against time, every quarter. They're going to get that little bit of a buffer in there by us doing a 100-day supply. So we're really, really excited to introduce that this year. And, just another item that goes into where when we say best in class DSNP plan, it's the truth. So once again, that's a little bit, of that continued. Members will pay $0, tiers 1 through 5, and then preferred and standard pharmacies. Producer World, you can go and pull up, the benefits specifically. But if you need something to that level, don't worry about going into Producer World to find that. Call me. I'll help you. I can email anything over to you. I can meet you. I can get you kits, whatever it is you need. Now, I encourage you to order kits, but if you're in a bind, you're going to have all my contact information. Let me know how I can help and help serve you. So just to quickly go over, and this is not a deep dive on everything that goes into duals, but who is going to be a dual eligible? What is the criteria for that? So it's going to be anyone age 65 or older, or under 65 with a disability such as intellectual, developmental, cognitive, physical, behavioral health needs, chronic medical conditions, or any age with end-stage renal disease. But this is a dual plan. So not only do they hit those criteria on the left, but they hit Medicaid eligibility criteria as well. They meet income and asset requirements in member of an eligible group, such as adults with disabilities, older adults, children and families, people who are pregnant, and others. So if you have questions on who is a dual eligible, get with Jason, get with me, and we can, do a deep dive conversation into that. So as I said, our plan doesn't just accept full duals or full QMB. As you see on the screen, these are all the levels of LIS that we accept onto our dual plan. QMB, QMB plus, Slim B plus, Slim B, Q1, QDWI, and then FBDE, which is other full benefit dual eligible folks. So, a number of folks who are going to be eligible for our DSNP plan here in the state of Alabama. This is very similar to the previous slide that had phone numbers to our vendors, but this one is a little bit different because it has our member services team at the bottom. But for our DSNPs, when we're talking about DSNPs today, really the only phone number that matters, and that's that care management team. So if you are writing DSNP with Aetna in Alabama, and I hope you are, that care management team phone number at the bottom of the screen needs to be on your favorites list on your phone, because it's an important phone number to have. So I'm going to leave it up for just another second, but if you were scrambling for a pen and couldn't find it, let Jason know, let myself know, and we will make sure that you have that phone number. So sales and service support. So this is our team here in the state of Alabama. Our director is Todd Skaggs. He has been with us for about 2 years now. He came from a long career at United Healthcare. Then myself, I am the North Alabama broker manager, as we've already talked about my history and me coming from Medicare Advantage specialist. And then we've recently hired a new broker manager for South Alabama as well. His name is Joe Walker, and he's got a military background, and he came to us from another FMO down in that area. He's just a great guy and extremely knowledgeable. So if you are, in some of those southern counties, let me know and I can get you in touch with Joe. Something else that we do a little bit different than everybody else here in the state of Alabama. We have what we call community lead generators. So what these lead generators do is they go out and set up events for agents. And I know you hear Jason and the MAS team talk about grassroots marketing all the time. And we, here at Aetna believe that grassroots marketing is the way that you build a successful practice in this industry. And we've got folks positioned to partner with agents to be able to get you out and to do that grassroots marketing and to be able to get in front of the community and promote your business. We just brought somebody on for the Birmingham market. Her name is Michelle Purse. I have just started working with her, and we're getting her up and running. We have brought someone on for North Alabama, so that Huntsville market. They will be starting at the end of the month. And then we are actively looking for someone in the central, that Montgomery-Dothan market for that. So we will be up and running here in about a month as far as events go here in the north, and hopefully we'll have Montgomery and Dothan squared away pretty quickly as well. So if you have questions about that, get with me, because these folks that are our community lead generators, their sole job is to help you find opportunity and to be in the market and to get in front of as many people as you possibly can. And then our internal sales support is Miss Lisa Phillips, and she is better at her job than she will ever know, and I'm a huge fan of hers. Sales kit breakdown, we've got 3 plans here in the state of Alabama: our Northern Alabama PPO, our Southern Alabama PPO, and then our DSNP plan. I guess I should say, I said 3 plans. I should say 3 kits here in the state of Alabama with all of those plans in each of those kits. So if it's in the South, it's either in the Southern Alabama PPO book or the Alabama DSNP book. If it's in the North, same thing. It's either in the Northern Alabama PPO book or the Alabama DSNP book. So here's where I'm going to start going pretty quickly, because I want to be very respectful of your time. So I'm going to go through these pretty fast. We've already talked pretty extensively about the over-the-counter at this point. This slide is a list of the stores currently that we have available for members to be able to go in store and utilize their over-the-counter benefit. This is a great reference piece to have, but it's also always changing because we're adding stores all the time. So there are some other ways that you can look these up. If you have questions about that, let me know. I don't want to spend too much time on that today. Healthy food card. We're going to talk a little bit about that more right now. So our healthy food card, $50 per month. It does not roll over, okay? I repeat that again. It does not roll over. So they need to be utilizing this benefit every single month. So this is a healthy food card, not a food card, not a get whatever you want card. It's a healthy food card. So there are restrictions, but they're very good restrictions on items that members can use this card for. So things that they can purchase it for: fresh and canned fruits and vegetables, frozen produce and meals, fresh salad kits, dairy products, meat and seafood, beans and legumes, pantry staples such as flour, sugar, spices, etc., healthy grains, bread, cereals, pastas, etc., nutritional shakes and bars, soups, water, vitamin water, things that they cannot use it for. And this should be pretty self-explanatory, but non-food items, pet items, alcohol, baby formula, candy, chips, coffee shop items, desserts, fresh baked goods, soda, and one so obvious I don't even know why they put it on here, tobacco. You can't use a healthy food card for alcohol and tobacco. This is gives folks a lot of options every single month for $50, and it gives them a lot of options to be healthy. So when we look at, they have this, where can they use this? Well, we have 30,000 participating retailers. 95% of the United States population is within 5 miles of a store where they can utilize their healthy food card. Stores here in Alabama where they can use it on a national level, big box stores. I know there are some, that may be a little bit more local, but on national level, we've got Walmart, we've got Kroger, we've got CVS, and surprisingly, we are owned by CVS. We even have Walgreens where they can utilize that. I have also heard conversations of them trying to get Publix into this mix, but I know that is not an easy process because there's a lot that goes into it. So, but even between Walmart, Kroger, CVS, and Walgreens, it's going to give them a lot of options on where they can utilize this. So when your members get enrolled into the Aetna DSNP plan here in Alabama, this is what they're going to get when it comes to the healthy food card. This is their member engagement package. It's going to have their card. It's going to have how to get their card activated, the 3 steps for that, and then going to also go into with them so they can see it, what they can and can't use their food card for. There's a digital tool with it where they can download an app and they can use their card directly from the app, and it will keep a running balance of it. And they can even, similar to like Amazon, if you're in a store and you want to know how much something is on Amazon, you open the Amazon app and hit the scanner and it'll scan it and it'll tell you right there. This app has a very similar concept. If they're curious whether an item is going to be accepted or not as part of their healthy food card, they can scan the barcode right in store and it'll tell them yes or no on whether they can get that item. So I know that's not going to be for all DSNP members, but cell phones and technology are getting in our hands more and more. And so, that is a great tool to have for those that are technologically savvy. And then they also have a website as well, which I always breeze over this one because if they're technologically savvy to go to a website, they should probably be using the app. And then for those that aren't tech savvy, they've got a 1-800 number where they can call and locate participating stores, determine approved departments and foods, and even check their current balance. So something for everybody when it comes to that. How does the healthy food card work? Pretty simple. Shop, scan, save. So that is our healthy food card. I'm going to breeze over our enrollment tool. If you have questions about this, please get with me. I can do a demo with you one-on-one. I've done a number of them for MAS and MAS agents, and I'll be happy to do that for you. To be able to get started with ThinkAgent, if you have anything Apple, so an iPhone or an iPad, you would go to the App Store and type in ThinkAgent. If you have an Android phone or tablet, you would go to the Google Play Store, type in ThinkAgent. Or the desktop version is available at the address on the screen, app.thinkagent.com. And I encourage everybody, it doesn't say this on here, make sure you're using that with Google Chrome. Once you get in and you have ThinkAgent on your platform, there's a number of different things that you can use this for: activity calendar, notification, member enrollment, which is the biggest part. Also, each HRAs, e-kits, lead management, event requests and updates, just a number of different things. So this is just showing you what it looks like to install the application. Go to the website, that's what you'll see. If you're going for the first time, you will just go to sign up. And if you go to sign up, it's going to ask you for 4 items. your name, your email address, your NPN, and your time zone. Once you complete that, we do not verify in real time. So in 24 to 48 hours, you will get 2 follow-up emails. One will have the username in it. The other will have a PIN number in it. You will use that PIN number to go back into the email where your username is, click there to complete registration, put in that PIN number. It'll ask you to create a password similar to what you see on the screen. And then once you have that, all you need is your username and your password, and you're ready to go. If you're having trouble signing up, call me first. But if I can't help, I'm going to tell you to go to support@thinkagent.com. That's where I get all of my support from, and they are wonderful. So I encourage you to do that today and get ThinkAgent as part of your technological application process, and then logging in and out. So what are your next steps? We've covered a lot of information in about 40 minutes. So, make sure that we're ready to sell, obviously. Make sure that you understand the Medicare Advantage communication requirements. Review and understand the producer guide. Download sales presentations and videos. It doesn't say it on here. Call John and let him help you get started, because that's what I do all day, every day. And I will be leaving here as soon as I'm done and doing that for another agent. So I do that every day, and I'm here to help you get started. Order your enrollment kits. Get with me if you have any issues about that. Oh, it does say that. Oh, excuse me. See your local broker manager for details. So one of the very last slides we're going to cover is a quick summary of everything. Why Aetna DSNP here in Alabama? This is pretty much the last 45 slides condensed into one slide. So we have a 32 county service area, including 11 expansion counties in 2022, which we went into. Best in class benefits, we've seen that line for line. 3,000 in dental in the north, 4,000 in dental in the south, $300 over the counter, $300 in vision in the north, $315 in vision in the south, $2,500 in hearing. We've talked about the $0 drug costs. We've talked about the model of care team. We really do, when we say have best in class benefits, we really mean it. We have agent co-op opportunities. If you're a producing agent here in the state of Alabama, I want to talk to you because I want to help you produce even more. I want to help you grow that business. Local community event coordination. We talked about that with our community lead generators. CVS retail. We have a CVS retail opportunity here in the state of Alabama. If you want to be in a CVS store 1, 2, 3, 5 times a week, whatever it is, get with me. Let me show you that process. Let me help you get started with that, so that you can, start working in that store, start getting familiar with that store, get in front of potential members, and if nothing else, start getting ready for AEP, because it's a great place to be in for AEP. Comprehensive new agent trainings. I'm doing those all the time on our agent training calendar. So if you need a link to that, let me know. I will get you on where to find all of our new agent trainings. Local care management team, comprehensive competitive commissions, robust virtual selling tool, which we've talked about in ThinkAgent, our value-based enrollment, the HRA options, ready to print Medicare marketing materials. I didn't even touch on that today. I can help you with that. Year-round training opportunities, and then national and local broker support to help guide you through your selling and retention process. Essentially, the last one is my job. I'm here to help you. I'm here to serve you. So with that, I have talked for about 40 minutes straight, so I'm going to pass it back to Jason for just a quick second and open it up for any questions that anyone may have. And I'm going to put myself on mute for about 30 seconds and take a sip of water.
All right. Well, John, I appreciate that. I do have one question, but we'll give you a chance to clear that palate and wash down that pollen that's everywhere.
I'm sitting in my office and I've got two big windows on either side of my desk. And as I was talking, I just see the pollen worms falling left and right out of the tree. So yes, that SIP definitely helps.
Gotcha. Well, hey, John, I mean, if everybody now doesn't see what you meant by best in class DSNP plan, I don't think they'll ever see it, because this hands down is the best DSNP plan I've seen in Alabama, period, out of all the carriers. So great job presenting it. I will go ahead and throw a question at you. Out of the 83 current CVSs that were on that OTC list, is Aetna going to sponsor any type of retail space for agents for AEP for 2023?
Yes. So with that, that's a great question, Jason. Let me go back right here. We have our CVS retail opportunity. And I was with an agent yesterday, got her started on her CVS store. We got her signed up. She wants to do her store for the rest of the year. So we got her signed up on her days in her store for the rest of the year. I'm meeting with another agent today that has identified a CVS retail store here in the Central Market, and I will be meeting with her, showing her how to reserve her store. And we provide the tablecloth, we provide the chairs, we provide the table. Literally all the agent has to do is to show up for when they sign up, and that's it. And so we pretty much do everything else for them. So we have a wonderful opportunity through CVS Retail, because as I said, starting this, we are a part of CVS Health. And so we are a little bit different than the rest of the carriers. We can put an agent into almost any CVS store throughout the state where they can work that retail opportunity.
Okay, that's great. For those that didn't know, that you don't have to wait until AEP to get your store. You can get in there right now. That's an awesome opportunity. So,
and I encourage you. I would say further than that. Not only is it an opportunity, but I would encourage you to get in there now, because you want to create that relationship with that store staff, so that they know when you're there and that you're coming, and you want them to know you and be familiar with you before AEP gets here, so that opportunity will even be greater for you.
Awesome. Well, that's it for the questions, John. You did a really good job explaining everything. So I want to give everybody a little bit of time back, and we really appreciate everybody on the call today. Again, give us a call if you have any questions at all. If you're selling DSNP in Alabama, you need to be selling Aetna's DSNP. But John, thank you for doing this for us today, and hope to see you soon.
Thank you, Jason. As always, the pleasure was all mine, and I appreciate everybody for attending, and I really hope you have a wonderful day.
All right. Thanks, everybody. Have a great day. Bye-bye.
Bye-bye.